Welcome into Rover Sports, Beach Edition, Zach Wheeler update. Come to you live from the Jersey Shore. We're happy to report that floods have receded, giving way to a beautiful 75-degree day here at the Jersey Shore. Breaking news is that pitcher Zach Wheeler of the Phillies had a successful thrombolysis, if you'd like, removal of his clot. And when they further investigated, they found that he had a compression of the venous structures, that is the veins, in the shoulder area of his pitching right shoulder. That is called vascular thoracic outlet syndrome. I'm here to explain what that means and how this will affect the Phillies' best pitcher. I'm also going to talk about his prognosis, and I'll be referring to the medical literature from the National Institute of Health to discuss his ability to return to play and also his ability to continue his career. So, first we need a little anatomy lesson. Vascular thoracic outlet syndrome is a condition in baseball pitchers where repetitive arm movements cause a compression and often scarring between three main structures. That is the clavicle, the scalene muscle group, and the first rib, which is deep to this demonstration. And what happens is the vein gets compressed. And what happens when a vein gets compressed, the blood flow is turbulent, and this causes the propensity for a clot. So indeed, that was the case. So Zach Wheeler, over a series of weeks, developed a dull ache and pain in his throwing shoulder. He also showed a decline in his velo, his pitching velocity, and it was determined by team doctors at the Washington Nationals, great pickup, that he had this syndrome called vascular thoracic outlet syndrome. He underwent a primary repair by Dr. Paul DeMuzio of Thomas Jefferson University using a catheter without cutting, and the clot was successfully removed. However, upon further diagnostic testing of sure MRIs, three-dimensional MRIs, it was found that this subclavian vein, this important vein, was compressed within those three structures: the first rib, the clavicle, and the scalene muscle group. So it was announced today, as predicted, on Fox 29 by your Cub reporter and Jason Martinez, the sports director, just a few days ago, that he would be able to return to play in about 6 months. I also talked about Matt Harvey and Tom Glavine, two other renowned pitchers who had the exact same thing. They had vascular thoracic outlet syndrome. They both required decompression, open decompression of the thoracic outlet, and both pitchers returned to play successfully. So indeed, Mr. Wheeler will be approaching this type of decompression surgery in the next week or two. And what is the best surgery? What's the best way to do it? It's either to approach the shoulder through the supraclavicular, which is above the clavicle entry, or the axillary, which is the armpit. They're the two best ways to approach this surgically. The most successful way to avoid recurrent problems with the thoracic outlet is to fully remove the first rib. That's called a first rib resection. In the literature, we've seen that partial removal of the first rib gives rise to bony regrowth and recurrence. That's not good. Also, there's a muscle called the pectoralis minimus, which is one of the pec muscles, and the best surgeons in the world will actually remove that muscle, and it will not hurt anything because, as the name would suggest, pectoralis minimus has a minimal involvement in that motion. And so that surgery involves an open surgical procedure, removal of the first rib, and something called a neurolysis, where the surgeon will carefully explore portions of the lower trunk of the brachial plexus, which is the nerve bundle in the armpit, and also explore the first thoracic nerve and make sure there's no scarring there. And once that whole area is opened up, there will then be a closure, and the recuperation period is approximately 6 months. A lot of questions we're getting right now on Rover Sports is this career threatening or career ending? Nothing is certain in medicine. However, good news is that 80% of patients, 80% of professional baseball players, including Matt Harvey and Tom Glavine, return successfully and have a full return to play. And the average duration of their career following this surgery is 3 years. That's also very good news for Zack Wheeler. That means that he's 35 now. He has a successful surgery. He comes back 6 to 8 months from now. Next year, we could project that he'll pitch well into his late 30s, maybe even to 40, given his strength, accuracy, diet, nutrition, and his regimen. So I predicted, and it was known, that the earliest return to play for any baseball pitcher following simple removal of the clot would be 4.5 months. So that puts us way beyond the World Series. So I think it was important not to give anybody false hope. But the fact is, when we fully remove the structures impinging on the subclavian vein, that dramatically reduces the propensity for the player to have a recurrent clot. So this is bad news in the short term, not unexpected, but very good news prognostically, given the National Institute of Health data that a full 80% of professional baseball pitchers undergoing this thoracic outlet syndrome decompression will return to play, full return to play in 3 years thereafter. So there you have it. This was an emergency update on Zack Wheeler, Sports Talk, signing off.